So, good afternoon, Commissioner O'Grady, Commissioner Brown, Commissioner Boyce, and County Administration. I'm Orville John, Director of Franklin County Office on Aging. Alongside me today is Becky Becker, Assistant Director of Operations, D'Amica Withers, Assistant Director of Support Services, and Amy Funk, Assistant Director of Administration for the Office on Aging. We are honored to share with you the incredible achievements of the Office on Aging from 2020 and what we are looking forward to accomplish in 2021. During the year 2000, just a second, we just realized we're not sharing with you the PowerPoint. Apologize. Is this one right here? There we go. It's the best we can do at the moment. We're getting ready to, I can't see that up there. Yeah, but I can't see it because it's on this. Just 1 second, apologize. You got it, all right. Here we go. We apologize for that. So I just wanted to share accomplishments with you in 2020. So during our year 2020, the Office on Aging experienced tremendous growth and progress toward the goals set forth in our agency. I'm extremely proud of the hard work of our staff during this year as they continue to effectively serve a population that continues to grow in both size and need. During this year, we are also proud to report our agency's efforts to join the ranks as an agency that is focused on results-based outcomes. During my time at Franklin County Office on Aging, I have pushed our agency to collaborate with the Board of Commissioners, community partners, and leaders so that we can be immovable advocates for those aging in Franklin County. As director, I'm fortunate to serve as part of the Franklin County Diversity, Equity, and Inclusion Work Group led by Keena Smith, Chief Economic Equity and Inclusion Officer, where I represent the voice of our older residents and ensure that our team at FCOA is receiving ongoing training to better understand and serve our clients and community. Internally, our supervisors, managers, administrators, and assistant directors have received DE&I training conducted by Courtney Kerrigan. In the coming months, they will also take part in implicit bias workshops as well. FCOA is making a serious effort in support of diversity, equity, and inclusion within our agency and with our service provider network. Within our service provider network, our contracted services support 95 small businesses, with 90 of them located in Franklin County. 53% of our agencies reported as minority business enterprises, and 11% reported as women business enterprises. We are also seeing a more diverse workforce with our home health aides and transportation drivers. In collaboration with the leadership of Franklin County Justice Policy and Programs, we continue to have conversations regarding individuals who are aging with criminal convictions. In conjunction with the Deputy County Administrator Joy Bivens and her staff at Franklin County Jobs and Family Services, we have joined forces to be part of her agency's new Family Stabilization Unit. The Family Stabilization Unit is a 2-year pilot program that is taking a multi-generational approach to effect positive change in the lives of young people in our county. Many older adults are becoming primary guardians, and their children and grandchildren have need assistance and are assessing the resources available to help keep them safe and create a positive future. The Family Stabilization work will be instrumental in making that happen. This year, Franklin County Office on Aging is partnered with Adam H. of Franklin County and NetCare Access to promote the Emotional Wellness Matters campaign. The campaign's objective is to recognize the importance of both emotional wellness and good physical health while aging in place. The Emotional Wellness Matters campaign is also designed to reduce stigma, increase awareness, and encourage older adults to access support and care. As we continue to move through 2020 into 2021, we are focused on this strategic outreach process and efforts to keep our older adults safe, healthy, and striving in the face of this pandemic. And we appreciate the guidance we are receiving from our county partners at Franklin County Public Health and Adam Age. Additionally, our agency served as co-chair for the Senior Citizen Subcommittee for the 2020 census, and we had a strong focus on ensuring all older adults in Franklin County were counted during this important process. Being a Board of Commissioner agency and levy-funded agency, it puts FCOA in a unique position to receive guidance from two supportive champions, the Human Service Levy Review Committee and the Franklin County Commissioners. On September 23rd, 2020, we had the privilege to present to the committee and share with them some of our results of the programs funded by the levy and how we have the opportunity, and now we have the opportunity to share some of that information with you as well. I would be remiss to not take this time to share with you the enormous toll COVID-19 pandemic has had on our agency operations and service delivery. Since the onset of COVID-19, we have maintained continued coverage of critical business operations. Like most other county agencies, we went from a total in-office model to deploying staff to work remotely. Our office went from 104 staff working in the building to an average of 15 to 20 personnel in the office daily. With the help of our IT staff and the team at Franklin County Data Center, we were able to quickly secure and distribute laptops and mobile phones for staff. We restructured the phone assessment process to handle the increase of calls, and we focused on abbreviated assessments and rapid starts of services. Our home visit staff are completing assessments and income verification by phone, and we compiled a centralized COVID-19 community resource file for quick access to available resources for older adults. Service delivery had to be reimagined, as we have responded to the impact on service in the following ways. We shifted service to a contact-free delivery by eliminating client signatures on service tickets. We permitted supervisory visits to be completed by phone. The first couple of months, we conducted weekly COVID provider, agency, and grantee webinars in collaboration with Franklin County Public Health to inform our partners of health department CDC protocols, how to access PPEs, and provide funding resources such as Paycheck Protection Plan, in addition to local and federal funding opportunities. Our transportation providers and drivers started utilizing PPE during transport and installing plexiglass barriers. They are experiencing longer wait times for drives through COVID testing. Initially, some clients suspended homemaking and personal care services, but this has lessened as the pandemic progressed. We are experiencing an increase in the home healthcare worker shortage due to the need for more workers experienced with COVID. Home health agencies have implemented safety protocols for direct services workers, daily health checks, education, and protocol regarding potential or actual exposure to COVID-19. We provided free meals to 5,134 Franklin County older adults without income verification, provided masks to older adults who requested them, and our case managers performed porch drop-offs of commodity boxes and food supply boxes for clients with critical needs. We took full advantage of CARES Act funding to fill gaps or enhance services employing COVID-19 response grants. To date, we have provided 5 grants to amazing community organizations serving the older population of Franklin County. We partner with Central Community Health and Community Refugee and Immigration Services to address socialization due to isolation and need for emergency assistance. The grant with Charitable Pharmacy of Central Ohio allows seniors to increase their supply of prescriptions as a way to limit their contact with others and ensure that there will be no gap between delivery. Our partnership with Clintonville Beach Wall, CRC, funded necessity boxes and friendly phone line for seniors to call and for assistance. And Life Care Alliance provided free meals for disabled and older adults. Office on Aging's performance measure spotlight for 2020 is the number of older adults residing in concentrated poverty areas of Franklin County who gained access to nutritious food. Our agency recognizes that access to quality, nutritious food is fundamental to human existence, stability, and improved health. In addition, food security exists when all people have physical and economical access to sufficient, safe, and nutritious food that meets their dietary needs for an active and healthy life. The agency will focus its outreach in specific zip codes where poverty is or high and improve access to supported nutritional services. These services will include increasing the number of home delivered meals provided to older adults in these areas and to provide funding support for congregate dining centers and mobile markets at senior centers and senior housing complexes within these targeted zip codes. This measure aligns with the Rise Together Blueprint Goal number 10, which aims to improve overall environmental conditions in neighborhoods of concentrated poverty so that they are safe, walkable, and have easy access to basic resources, including access to nutritious food. Our Franklin County Office on Aging, we deliberately focus on addressing poverty as it pertains to older adults in the county. With Rise Together Blueprint for Reducing Poverty as our directional North Star, we have undertaken the following measures that address and improve conditions of poverty. Under jobs, we identify needs and challenges that home care workers and providers are facing. We are anticipating conversations and opportunity with improvement as it relates to the disparity in hourly pay, recruitment, and retention of workers, and lack of benefits. We've hosted racial equity training with agency leadership in June 2020. We're providing wraparound support for families, navigating the human services system to address their unique needs through a racial equity and social determinants of health lens. We assisted qualified mature job seekers find employment through the utilization of the services of the volunteer counseling team. Volunteer counselors interview and counsel mature job seekers, register them for services, and provide the information necessary to pursue the job. Under housing, we provide services and programming that helps seniors stay in their homes, such as one-on-one assistance to seniors in crisis situations, especially housing-related ones such as evictions. Linkages to home maintenance and repair resources, transportation to medical appointments, minor yard work, snow shoveling, as well as active opportunities to socialize and meet their neighbors. Under health, we provide awareness to older adults, encouraging the safety of and access to mental health services, provide a system of individualized support to help seniors be stable in their homes by meeting basic needs, ensuring health and wellness, and providing advocacy. In 2020, we launched our outreach campaign to provide increased access to nutritious food for older adults in the Franklin County neighborhoods of concentrated poverty. We targeted the 43204, 43207, and the 43224 zip codes where poverty levels are high and a high population of older adults reside, as well as partner with Memorial Baptist Church to deliver meals to the 43224 zip code area. From April 1st through November 13th, we delivered meals to 773 clients in these zip code areas. We offered home delivered meals without income verification. Under the youth category, we provide education and empower grandparents and other kinship providers through educational workshops. And FCOA is hosting 4 Crystal Ray High School students for a professional work study experience. While these incredible collaborative opportunities have helped progress the agency into the next evolution of operational efficiency, we have continued to work diligently to preserve the independence and quality of life for those aging in Franklin County. Our core programs had great achievements during 2020, and we are excited to keep that momentum going in 2021. I would like to turn the presentation over to Assistant Director Becky Becker to share with you our accomplishments and future goals of our home and community-based care program. Becky.
Thank you, Director Johns. The purpose of the Home and Community-Based Care Program is to provide need-based services to Franklin County older adults and their caregivers so they can preserve their independence and experience and improve quality of life. The Senior Options Program offers a one-stop shop designed to provide information, referrals, and easy access to enrollment for needed home and community-based services for older adults and their families. Since January 2020 to date, we have served 9,586 older adults through the Senior Options Program. Of these members, 41% are African Americans, which is above the 22.2% of the African American population living in Franklin County. While the Senior Option Program connects older adults to a multitude of services to help them age in place, our most utilized services include home-delivered meals, transportation, and homemaking. In 2020 thus far, we have provided 743,719 home-delivered meals, 977,757 miles of transportation, and 69,972 hours of homemaking services for those over the age of 60 in Franklin County. In addition to these services, the program also provides funding for emergency response systems, adult day health, personal care assistance, respite, nutritional supplements, incontinence supplies, and durable medical equipment. Program changes we have made this year include the following. We have started we are starting services prior to a home visit. We enrolled clients for services that are not provided by another funding source. And we finalized the client stratification tool that is being used by case managers to identify our most at-risk clients and provide more equity in caseload assignments. We currently contract with 95 for-profit and nonprofit businesses to provide our home and community-based services. Out of the 95 businesses, 53% of these agencies self-identified in their small and emerging business enterprise form as minority-owned, and 11% have reported women as the owner. This is a real example of how Franklin County is supporting the economic inclusivity of small businesses. Our Quality Improvement Department spends hundreds of hours each year conducting structural reviews, compliance audits, training and coaching agency staff, and technical support visits with our contracted businesses providing services on behalf of Senior Options. Since the onset of COVID-19, the QI staff have developed a virtual training module that is now being used for training provider agency staff and new Office on Agency employees. Just this month, the commissioners approved our final home care contract renewal. In 2021, we will conduct an invitation to bid for our central order contract and begin preparing for the next contract bid for home care services. We will conduct stakeholder meetings and explore creative incentives for attracting home health care workers to serve our older adults. The COVID-19 pandemic has added to an already scarce home health care workforce. I'd like to now turn the presentation over to Assistant Director Withers to talk about our efforts with community support, outreach, and specialized services.
Thank you, Becky. The Community Support Outreach and Specialized Services Program funds community-based nonprofit and governmental agencies that deliver specialized services to older adults and their families. With these partners, we have focused on 3 collective impact process projects thus far. The impact of the opioid epidemic amongst older adults and how that leads to kinship relationships, challenges the affordable housing crisis create for seniors aging in place, and mental health in older adults. In 2020, we've partnered with Adam H. of Franklin County and NetCare Access to increase awareness, empower self-care, and help normalize emotional health treatment and services as an important aspect of routine healthcare for older adults. These awareness activities include a social media campaign, Valpak flyer, and an NBC4 bank where representatives from Adam H. Franklin County, Concord Counseling, NetCare Access, North Central Mental Health Services, and FCOA receive calls from older adults regarding their emotional wellness and FCOA core services. Earlier this year, we met with the Senior Housing and Wellness Navigator to coordinate efforts to help serve older adults engaged with Central Community Houses' Seniors Stay Central program. We've completed several professional development sessions with county agencies and community organizations, such as Sexual Assault Response Network of Central Ohio, or better known as SNARCO, Franklin County Auditors, the Coroner's Office, and Treasurer's Office, informing them of FCOA services and how they can better serve their older adult clients. We also focus our support in areas of safe socialization for urban aging residents impacted by community violence. Along with these community efforts, we continue our presence on Facebook, Twitter, and the Messenger newspaper. As of September 30th, 2020, we have had a presence at 19 community outreach events that does not include the aforementioned. Our agency's caregiver support program continues to provide free short-term supportive services to the older adults of Franklin County through in-home respite services, durable medical equipment, adult day services, appliances, and caregiver counseling. As of October 31st, 2020, we have served a total of 151 in the caregiver support program, which is down by 55% served by this time in 2019. The COVID-19 pandemic highly affected the caregiver support program due to the closing of the contracted adult day centers, state restrictions placed on institutional respite facilities, and limited staffing and service hours with contracted in-home providers. With the lack of spending, we have been able to increase the amount of hours and services for the individuals who receive support through the caregiver support program. In 2021, we are looking forward to increasing our partnerships with county agencies and community organizations who are working with kinship families such as Franklin County Children's Services, Clintonville Beach Walk Community Resources Center, and State Stevens Community House through the kinship component of the caregiver support program. I'd like to now turn the presentation over to Assistant Director Funk to talk about our efforts with the Customer Service Management Program.
The Customer Service Management Program is in place to provide individualized customer services to older adults and their caregivers so they can access a trained professional to help meet their needs. The Franklin County Office on Aging prides itself on having a dedicated case management staff that is committed to serving the aging population in Franklin County. In 2020, year to date, we have served 9,586 clients through the Senior Options Program. Customer service satisfaction, one of our key performance indicators, is of immense importance to this program. In 2020, we received a 94% satisfaction rating for this program. The agency's main phone line, 525-6200, is a one-stop shop for aging-related information, referral, advocacy, crisis intervention, and assessment. This number is also the entry point for enrollment into the Senior Options Program, where callers speak with a live person who can address their needs. Currently, Senior Options is averaging 257 calls per day on the ACD line from Franklin County residents requesting Senior Options services. The Senior Options INR service has maintained its accreditation status with AIRS, the National Alliance for Information and Referral Systems, and we are actively working towards reaccreditation. Senior Options case managers, after 1 year of employment, are eligible to take an exam to become AIRS certified information and referral specialists in aging and disabilities. Presently, 64% of Senior Options staff carry this designation. Year-to-date, the number of callers served through information and referral, advocacy, and crisis intervention is 6,834. While these services are at the core of our service delivery at the Office on Aging, our efforts to keep the public informed of our work is of equal importance. Now I'd like to share some of the great things happening in our public information program. The purpose of the public information program is to provide information, education, and consultation services to older adults and their caregivers so they can gain knowledge and access to resources and services. In 2020 to date, the public information program has reached over 6,300 older adults and caregivers through 23 outreach events. Of that amount, due to the pandemic, only 5 events in the first quarter were in-person events. The remaining 18 virtual events included sponsorships of the Ohio Coalition of Adult Protective Services Conference, Ohio National Association of Social Workers Conference, Ohio Association of Area Agencies on Aging Conference, and the Ohio State University Retirees Conference, to name a few. The Public Information Program coordinates 3 special events designed to provide entertainment, socialization, and resource information for older adults and their caregivers. Due to concern for the safety of our older adults, attendees, and staff, we postponed 2 of those events to 2021. The remaining event, Flourish Franklin County, which was held at Franklin Park last year, went virtual in 2020. This event is created to educate, empower, and engage women age 60 and over. Through a partnership with the City of Columbus television station, we produced a pre-recorded program featuring local organizations, interactive demonstrations, and a musical performance. The program aired on the City of Columbus station, local cable stations, YouTube, and Facebook. The program has been viewed over 400 times, which is twice the number that attended the event in 2019. 2 social media platforms, Facebook and Twitter, are utilized to inform the public of our agency programs, services, special events, and other information important to older adults. In 2020, our Facebook followers increased to over 900. In 2021, we plan to add LinkedIn to our social media portfolio to increase our followers on social media. In addition, the Public Information Program plans to continue its marketing efforts to connect Franklin County older adults with senior options. The focus of our marketing will continue to be aimed at getting older adults connected to senior options services earlier versus waiting until they are in crisis. The marketing plan has produced 3 television spots that highlight Franklin County Office on Aging, senior options, and adult protective services. A televised phone bank providing resources for older adults experiencing mental health issues during the pandemic was held in partnership with AdamAge and NetCare. Future marketing plans include how-to videos and a new agency video. I'd like to now turn the presentation over to Assistant Director Becker to talk about the accomplishments and goals of our Safe Housing Program.
Thank you, Amy. The purpose of the Safe Housing Program is to provide minor home modifications and repairs, safety assessments and products, and assistance to eligible Franklin County residents so they can live in their homes free of barriers and unsafe conditions. As older adults continue to age in place, especially in their own homes, it is imperative that they have the support to maintain the safety of their homes. To date, the Senior Options Home Repair Program has completed 1,164 minor home repairs, which is inclusive of 8 wheelchair ramps, 250 grab bar installations, 51 exterminations of homes for pests, and 96 furnace repairs or replacements. This program also provides moving services and major cleaning of homes with hoarding and biohazard conditions. During the Office on Aging's Housing Strategic Outreach, along with the work of our customer service work group, we learned that older adults in Franklin County have additional safe housing needs around handyman, lawn care, and snow removal services. We are currently exploring collaborations with other county agency partners to potentially expand the types of services under this program to meet these unmet needs. I will now turn the presentation back over to Assistant Director Withers to discuss our efforts with protective interventions.
Thank you, Becky. The purpose of the Protective Interventions Program is to provide advocacy for client rights, investigations, court intervention, and other assistance to abused, neglected, and exploited vulnerable older adults so they can be protected from individuals or environments that endanger their physical or emotional well-being. From January 2020 through October 31st, 2020, Franklin County Adult Protective Services has handled 5,300 calls to the intake line. Of those calls, 62%, or 2,157, were investigated for allegations of abuse or exploitation of an older adult. COVID-19 has had a great impact on APS services. Under the direction of Ohio Department of Job and Family Services, we were declared a critical service and received guidance on protective questions to ask before going to a home visit. Typically, initial visits are unannounced, but the safety of our staff and our residents are a priority. Staff are provided with personal protective equipment such as face shields, gloves, masks, and hand sanitizer for safe home visits. In partnership with Franklin County Public Health, we recently held a question and answer session with home visiting staff and Franklin County Public Health representative to discuss safe home visiting practices. In 2020, the APS department was impacted by several vacancies: 4 case managers, 1 supervisor, 1 social work assistant, and a program administrator. The impact of the case manager and supervisor vacancy had a direct effect on case determination and time management of cases. We will enter 2021 with only 1 vacancy, the social work assistant. In 2021, the APS department priorities are to become more compliant with Ohio Administrative Code as it relates to the number of staff required trainings, increase our timeliness rate to 95%, develop internal case audit practices in preparation for ODJFS's quality assurance audit scheduled to begin in 2021. And now I'd like to turn the presentation over back to Director Johns for closing remarks.
So actually, we just want to thank you, commissioners and county administration, for the opportunity to share with you the work that we've done here at Office on Aging on behalf of you, commissioner and community, and the team here welcomes any questions you may have.
Thanks, Director, and thanks to your team. So just some minor questions. So your budget is increasing for next year overall?
I'm going to say it should be about the same, but I know it's you, so we're trying to get the exact number, Commissioner Boyce.
Well, there's so many, as I was reading through your actual budget document, I saw a number of variances that were in the negative. And so my question, but then I see that the overall number is only a slightly, it looks like reduction from 2020 to 2021. And so I just trying to make sure I understood that either it's generally, it looks like your budget decreased by $600,000.
Yes. Amy's Gary come and address that.
Okay. And then I'm just trying to understand where those cut. I mean, a lot of them look like vacancy credits, but I want to just make sure I understand if that's going to transfer in some type of staff reduction for this year, and if there are any issues or areas that you're concerned about with some of those potential vacancy credits or the lack of not hiring a position or two?
Thank you, Commissioner. So to address the vacancy credits, one of the things we're trying to do within in compliance with the operational review report was create a call center. And to create that call center, we wanted to use current openings instead of trying to ask for additional positions. And so we left those open until we can come together and figure out exactly how that call center would look. And then we will use those positions to fill that, fill the call center.
I mean, I just want to make sure I understand that, I mean, again, this is one of those areas where we have to be careful that in, a very vulnerable time for everyone, the population you serve is more vulnerable. And we want to be mindful of that in the sort of the crunch time, if you have 2021. And so when I saw many of the reductions in the different areas, I just wanted to make sure we weren't missing a need there that impacted services.
Director Johns, just if I don't mind stepping in, Commissioner, part of the reason for the decrease in personnel is related to the one-time 27th pay that occurred in 2020.
Oh, okay.
So with going back to 26 pays, that is the reason for the decrease. In terms of vacancy
the
credit,
entire $600,000.
Primarily, yes.
Okay.
So the vacancy credit for the senior services fund remained at 2%, which is below the 4-year average, again, to be able to give the Office on Aging flexibility to be able to hire those positions, as you mentioned, the critical need to get those filled.
Okay.
Thanks, Director Tularic. I was going to also chime in on that. The Senior Services Fund has a 4-year average vacancy level of 7.5%, but yet the budgeting only includes a 2% vacancy credit. And then in the Adult Protective Services Fund, the vacancy credit there is 6.5%, whereas the 4-year average is 11.5%.
Okay. And so I just want to be confident I just want to feel confident that you're not concerned of any service drop off with any, because what it sounds like what you're saying is that they're not true cuts. They're just sort of temporary places in how we sort of accounting for not hiring during a certain period of time, basically.
And if you look at the bottom line, there's a net FTE reduction of 1 position. But
where are you referring to? What page?
Inside of the budget brief, page 6, where you're looking at the FTEs, total FTEs. It provides an explanation for the net 1 reduction in FTEs in the agency overall. There were
but again, you're not concerned with any kind of service delivery with that.
I am not, because we contract out externally for the work that's being done, be it meals on home delivered meals, be it home care services, be it transportation, a home repair program. So I'm not where the budget sets it will not impair our ability to provide services externally during this upcoming year.
Okay.
Thank you.
All right. Thank you.
Orville, I had a question about the mental and physical health of our workforce, as well as the residents we serve during COVID. And how is everybody doing? And is there anything we ought to be doing more to make sure that everybody's feeling comfortable, both on the staff as well as our residents, to make sure that everybody's feeling safe and healthy during this time?
Well, I appreciate that question because it shows your compassion about the workers. So I appreciate that. So there's 2 folds to that. Our staff, our case managers and staff are really concerned about our seniors during this time. And I know we've talked about it several times, but we need to bring it up as often as we can, that because of this isolation, because of this angst and this stress, it's causing a lot of anxiety to our seniors, and there's no one there generally to comfort them and to relieve their anxiety. So often our case managers give them a call. We do have check-ins at times with our seniors, and often when the seniors call, their phone calls are a little longer than normal because they want to engage in conversation, and we welcome that. So that's part of it. But in doing that, we also aware that our staff becomes a little burdened as well. But you can't just hear difficult situations throughout the day and it not bother you. You know, we our supervisors check in with them often, and we are also encouraging them to share with us if they have some issues. We definitely make sure that we check in during supervisory meetings to see how everybody's doing. So there are those check-ins. But collectively, we know the work that we need to do is important, and sometimes we focus more on the work than on ourselves. So leadership here is constantly reminding everyone to take a little bit of time for themselves as well.
Thank you.
Commissioners, if there's no other questions, I'd like to thank Director Johns and his team for their presentation this afternoon.
Thank you. Thank you very much. All right.
Thank you.